This is KTVO's Good Morning Heartland.
And welcome back. Did you know that Northeast Regional Medical Center is home to the Vein Center? To learn more about the facility and services they offer, we have Dr. Dana Valencia, a cardiologist at the Vein Center. Good morning. How are you doing today?
Doing well. Thank you for having me.
Thank you so much for coming on. So before we talk about what we're going to be discussing today, I was not familiar with the Vein Center that you have to offer. So kind of just talk about that all together.
Okay. Well, we have this new center called the Vein Center, and it's an opportunity and a service that we provide at Northeast Regional Medical Center where people that have suspected vein issues, venous disorders, we're able to treat that. We're able to diagnose and actually perform ablation procedures.
All right. Now, one thing that we're going to focus on today is venous reflux disease, which is common for some people. So talk about that. What is that?
Well, chronic venous insufficiency or reflux is one of the very common diseases that it's out there. And it's actually sometimes maybe misdiagnosed as heart failure. And so we need to evaluate those patients. And it's actually a disease, disorder of the veins of the legs. And it affects the blood flow that returns back to the heart. And when the heart does not get its oxygenated blood, you get symptoms of the lower extremity of swelling, pain, cramping sensations, shin splints, and then actually skin findings such as ulcers. And so that's why we need to treat those patients.
So why does a cardiologist treat patients with venous reflux disease?
Well, I'm a cardiologist as well as I love specializing in venous issues as well. You can also see a vascular surgeon that does both the arterial and venous system as well. Anything that affects the veins, that returns blood back to the heart, I'm able to evaluate those patients. Right. And we have a great opportunity here at Northeast Regional Medical Center where we could assess, evaluate, and treat those patients.
All right. Now let's talk about varicose veins. What are the risk factors associated with those?
Well, the varicose veins, there's many risk factors, which includes family history, increasing age, obesity, pregnancy, prolonged standing, in jobs that have prolonged standing, and people that have prior blood clots, or DVTs we call them.
And now let's talk about some treatment plans and services about that. I know that my family history, actually, we have a history of varicose veins. So kind of just talk about if, you know, once I start getting a little older and stuff and start experiencing those, what are my options to kind of treat those?
Well, the first option is to see if you really do have varicose veins. We have a screening assessment program there, so you could actually come to the hospital and get evaluated and see what degree of varicose veins. There's severe varicose veins. And so, first of all, you need to avoid prolonged standing, get evaluated, wear support stockings, and then get assessed and see what the degree is using ultrasonography here at the hospital. And then from there, after conservative therapy, such as wearing support stockings, then you see your doctor if you still have refractory symptoms, and then maybe get evaluated for treatment.
All right. Now, does varicose veins affect older generations, or can younger people actually start experiencing problems?
Well, a case example, if you get varicose veins because of prior blood clots, okay, so if you have prior blood clots, then we could, assess or treat the blood clots, and then afterwards, hopefully there's no venous insufficiency. Like the name sounds, it's reflux, it goes backwards. And so we treat that for a conservative period of time, and then depending on symptoms, we can use conservative or aggressive therapies.
All right. All very interesting information and valuable information, too. Now, if somebody is dealing with this and needs help or needs to talk to a doctor, do they need some sort of referral to get to the Vein Center?
Not at all.
Okay.
You could do actually self-referrals.
Okay.
If you have any of the symptoms, such as the symptoms of fatigue, cramping, just heaviness, almost like heart failure type symptoms that may be possible venous disorder, you could call the Northeast Regional Medical Center at 660-785-1991 and get set up for a screening assessment.
Okay.
And then from there, we'll determine which degree to go next.
Perfect. Well, thank you so much, Dr. Valencia. What we'll do is we'll post everything on our website at heartlandconnection.com, and we'll also link up Dr. Valencia's information with the Vein Center if you have any questions or concerns. Again, thank you so much for coming on.
Oh, you're very welcome.
And we'll be right back.